Our region's business is sponsored by PNC for the achiever in you. Welcome to Our Region's Business with your host, Bill Flanagan.
Today on Our Region's Business, we're here on Pittsburgh's South Side, a neighborhood that's undergone a transformation over the past generation. Now, we could be here to focus on the community's thriving and sometimes controversial nightlife, or on the transformation of the old J&L steel mill into the South Side Works. But we're actually here to focus on a different type of development today, the emergence of the South Side as a hub for our region's life sciences industry. You see here, just a few miles from our research hub in Oakland, no fewer than 21 life sciences companies have set up shop. Much of the action is related to the Pittsburgh Life Sciences Greenhouse, which is celebrating its 15th anniversary as our region's only economic development organization devoted exclusively to growing life sciences companies. We'll begin our exploration here on Jane Street, near the foot of the South Side slopes. We're here to visit a company that's been billed as Pittsburgh's oldest startup. It makes lung assist devices. And this granddaddy of our modern life sciences sector is called ALung. Pete DeComo is president and CEO of ALung. Jim Jordan is CEO of the Pittsburgh Life Sciences Greenhouse. And welcome. Good to have you here. And Pete, thanks for hosting us.
Oh, welcome. We're proud to show off.
Yeah, ALung has come a long way. How long has the company been around?
20 years, believe it or not. We joke and say we're the oldest startup in the city.
The oldest startup in the city. Well, it illustrates in the life sciences, it takes a while to bring technological innovations to market.
It takes a long time. It takes a long time. It requires a lot of perseverance and a lot of patience on the part of investors.
Well, speaking of a long time, Life Sciences Greenhouse celebrating its 15th anniversary this year, which is pretty remarkable.
Very exciting.
Yeah, for folks who don't know the organization, what are you all about?
So the Pittsburgh Life Sciences is oriented towards helping companies start from the universities mostly, and also from entrepreneurial companies, and the goal is to be able to advance them to a point where they can get venture capital funding. So we're usually some of the first money in that high risk capital.
So you'll work with what? Innovations coming out of the universities, the
as in a
healthcare
medical
systems
devices,
here?
a pharmaceutical. ALung is an investment of ours that we worked with at the very beginning of the greenhouse.
Wow, and where does the money come from to do all of this?
So the money comes from the state and the foundations, and when we make returns, we plow them back into the community.
And so Pete, now where did ALung come from? Well, we should first say what exactly it is ALung does, what your technology is all about.
We are a medical device, and in simple terms, we're an artificial lung that sits outside the body, and we take blood from the body, we treat it in the artificial lung, we remove carbon dioxide, provide some oxygen, and then we return it back to the body. And so patients whose native lungs are compromised, this artificial lung bridges them back to recovery.
So it's like it sounds like kidney dialysis for carbon dioxide or for breathing, right?
Exactly, and we actually have trademarked the term respiratory dialysis. We're the only company that can use that term.
Pretty exciting. And you were a spin-out originally of the McGowan Institute, which we're going to hear about later in the program today.
That's correct. This technology came out of the McGowan Institute for Regenerative Medicine. The company was actually formed back in the late 90s. The founder and inventor was Dr. Brack Hatler, a renowned cardiothoracic transplant surgeon based here at the University of Pittsburgh in Pitt, and Dr. William Fetterspill, who still runs the medical devices laboratory at the McGowan Institute, with which we have an ongoing collaborative relationship.
Is this a pretty typical story in the life sciences space and how long it can take to bring a company to market?
It's typical, but it's also why someone like the greenhouse is important and existing, because technology is not enough. You need to be able to navigate the system and position the system, and there's this simultaneous equation in startups going on that you're trying to satisfy the customer, you're trying to make a proposition that investors can understand, and then you're trying to find an acquirer. And I think that one of the things that Pete brought to the organization is he talked very simply about it's like respiratory dialysis. And I remember in the early years that it was very confusing to people what that technology did, and Pete came in and he recognized that it needed to be simplified, the concept, so that people wouldn't be afraid of it. And so That's not technology, is it? That's positioning. And I think bringing seasoned executives is key. And so I would say half the life of the company was finding its business model and getting the right talent around the table, which you see here before you today with all that's been built here.
Well, it's remarkable. And then having a greenhouse has helped you a lot in bringing this company along?
Oh, absolutely. This company wouldn't have gotten off the ground if it weren't for organizations like the Life Sciences Greenhouse that provided that early mentorship, that early funding that was necessary to begin the early development of the technology and evolve it to what it is today.
How many companies have you worked with, or the greenhouse worked with?
So we've worked with
15?
over 450, and we've invested in 80.
Invested in 80. And of the 80, are they all still going concerns,
So
or where are they in their cycle?
Of the 80, they've attracted $1.5 billion to the region in equity. There's been $600 million in exits. And so right now we have 51 that are still active.
And a lot of them seem to have clustered right around your home base here on the south side.
They have, and it's been something that as we were preparing for this, we were very surprised about how many companies are in this area. We have 15 to 21 just on the south side, and we were joking earlier, that's there's roughly another 75 healthcare providers and service organizations around here. So it really is a region and an area of this town that is very attractive, and as we were reflecting upon it, it's the ability to get up to Oakland and the university so quickly, which makes it very helpful for an economic development perspective.
Well, and at least until recently, fairly affordable, fairly stable in terms of real estate, although I guess that's changing even here on the south side these days.
It is. It's becoming more of a demand to be in this region, and the rental rates are not getting up into the market level that they used to be below then.
Yeah, well, and I remember 30 years ago, that was one of the objectives for the south side. Someday we'll get to market, and
That's
we're kind
right.
of getting there. So where is ALung in terms of commercialization and getting this technology into clinical use?
Well, actually, the technology is in clinical use every day. We're approved in 35 countries outside of the United States. We treat patients every day. We have treated patients in the United States under the emergency use provision of the FDA, and in fact, about 5 years ago, the first patient we treated in the United States was here at UPMC, and we saved that young man's life. And it was all over the news at that time, and we're proud of that fact. We've treated 6 patients in the United States, and we have been approved by the FDA for an expedited review process, and we will begin a very large landmark pivotal trial by the end of this year.
Wow, really exciting. Yeah, and in that terms of return on investment, Jim, do you track that at all? What kind of impact you're making on people's lives and health?
We do. We've actually, all of the companies that we've invested in have brought in 2,300 direct jobs to the region, and if you multiply that by a multiplier, it's almost 14,500 jobs. So it's really material, and those salaries, as many people know, are greater than the average.
Wow, so all of this having a tremendous impact on our region. Congratulations,
Thank you
Jim
very
Jordan,
much.
on the 15th anniversary of the
Thank
Life
you.
Sciences Greenhouse, and continued success, Pete DeComo with ALung.
Well, thank you, Bill. It's a
Thanks
pleasure.
so much. Next up, we're celebrating another anniversary, the 25th, for the McGowan Institute, a pioneer in regenerative medicine. We'll find out what's happening on the cutting edge of tissue engineering, artificial organs, and medical devices. Stay with us.